Welcome everyone. I am Chinmayi R and today we are going to discuss about three kidney diseases: renal calculi, acidosis and alkalosis. Renal calculi, also known as kidney stones, are solid and insoluble stone-like substance formed by various crystalline salts and other constituents of urine. It can be formed anywhere in the urinary tract, either at renal tubules or at the external opening. Normally, urine contains several minerals in a supersaturated state. When these minerals precipitate, they crystallize and deposit repeatedly around a small organic matter known as the nidal, forming a kidney stone. The common constituents of the stone or kidney stone include calcium carbonate, calcium oxalate, calcium phosphate, urate, and uric acid. Some stones formed in the renal pelvis do not cause pain or symptoms, and they are called silent stones. Other stones may cause hematuria or blood in urine and pyuria, which is spices in urine. So there are types of calculi. One is staghorn calculi and other is dendritic stones. Staghorn calculis are stones which grow large, highly branched and fills the entire renal pelvis and calyces. And dendritic stones are a related form of staghorn calculi occupies only a few cats. When small stone fragments pass through the ureter, they cause renal colic, which is severe intermittent pain radiating from the flank to the groin or inner thigh. And if a stone blocks urine flow in the ureter, it leads to the swelling of the kidney, also known as hydronephrosis. Prolonged hydronephrosis can cause permanent kidney damage. Several factors responsible for kidney stone formation include excess intake of mineral salts, low water content in the body, hyperactivity of parathyroid glands, alternating acidic and alkaline reactions of the urine, infections of the kidney, lack of vitamin A in the diet, high level of calcium in urine, excessive sweating which may cause the production of concentrated urine. Next is acidosis, also known as acidemia. It is a condition characterized by increased acidity of the body. In this condition, the body pH falls below 7.35, whereas the normal body pH is between 6.8 to 7.35. It is resulted either from the accumulation of acids or the loss of bases without any compensatory changes. Severe acidosis is characterized by four major events, namely total body sodium gets mostly depleted when plasma sodium level falls very low and total body potassium level becomes very low and level of plasma potassium remains almost normal. Two abnormal acids are produced during acidosis. They are acetoacetic acid and beta-hydroxybutyric acid. These acids are formed due to the faulty fat metabolism. In acidosis, there is also a reduction in the alkali reserve of blood. Acidosis commonly occurs in untreated or poorly treated diabetes mellitus, starvation, persistent vomiting, and at the terminal stages of glomerulonephritis. Mild acidosis may also occur during severe fevers, especially in children. Common symptoms of acidosis are general lassitude or weakness, severe vomiting, increased thirst, restlessness, presence of acetone in. There are three major types of acidosis, namely respiratory acidosis, renal acidosis, metabolic acidosis. Respiratory acidosis is caused by abnormal high PCO2 in blood due to hypercapnia and hypoventilation of lungs. It is two types, acute respiratory acidosis and chronic respiratory acidosis. Acute respiratory acidosis is caused by general anesthesia, use of narcotics, sedatives and barbiturates, cardiac arrest, pulmonary edema, severe pneumonia, laryngospasm, bronchospasm, tetanus, etc. Chronic respiratory acidosis is commonly caused by pulmonary diseases like chronic bronchitis and emphysema, brain tumor, stroke, poliomyelitis or polio, arthritis, prolonged pneumonia, obesity, etc. Renal acidosis results from the accumulation of urea, creatinine, and the metabolic acids of protein catabolism. Metabolic acids occurs due to accumulation of non-carbonic acids or excessive loss of bicarbonate ions from extracellular fluid. Major causes of renal and metabolic acidosis are gastrointestinal and renal loss of HCO3-, renal dysfunction, adrenal dysfunction, etc. This is a flowchart of acidosis classification. The next and the last topic is alkalosis. It is also known as alkalemia, which is the opposite condition of acidosis. It is characterized by low hydrogen ion concentration in arterial blood. In alkalosis, the blood pH rises above 7.45 due to accumulation of bases or loss of acids without compensation. The symptoms of alkalosis include dizziness, numbness of hands and feet, confusion, nausea and vomiting, muscle spasm, seizures, low oxygen levels in blood, loss of consciousness. Conclusion. To conclude, renal calculi affect the urinary systems by obstructing urine flow, while acidosis and alkalosis disturb the acid-base balance of the body. Proper kidney function and metabolic regulation are essential for maintaining homeostasis. These are my references, and thank you. Have a nice day.